Welcome everybody to today's webinar on new advances in cryosurgery. With us today is Jason Dominguez, a physician's assistant practicing at Chappel Rosso Dermatology in Odessa, Texas. So welcome, Jason, and thank you very much for sharing your experiences in cryosurgery and in your practice today with everybody who's watching online. I very much appreciate that.
Thank you.
So just to start, can you tell us a little bit about what you do at the practice and what kind of treatments perhaps you focus on?
Sure. I'm a PA at a very busy dermatology practice, and we focus on several different areas of dermatology. Our office, we do Mohs surgery, which treats surgical procedure for skin cancers. We do medical dermatology, which can include acne, severe rashes, psoriasis, things of that sort. We also do cosmetic. My daily treatments that I provide are mainly medical. I do a little bit of cosmetic, and that involves both making diagnoses and doing medical procedures.
Mm-hmm. So in the area of cryosurgery, what kinds of indications do you usually treat with cryo?
So cryo is a great tool that's been around for a long time, and cryosurgery is used a lot in our office. There's 4 providers here, and we use it for multiple things. The most common conditions that I see and use cryotherapy for are seborrheic keratosis, warts. I also use it for a condition called molluscum contagiosum. We use it both for medical purposes and cosmetic purposes. That means that some people may have some of these types of skin lesions that I've listed that may be medically necessary to remove because they're bothering them or they're very irritated. Or some people just come in and they want them off, because of cosmetic reasons.
Mm-hmm. Do you also get a lot of referrals?
Yes, sir, because we're a specialty like any specialty. We receive a lot of referrals around our area. I'm in an area where it's a very, very great medical area. So we have several small surrounding towns and a pretty big radius. So we are very busy with referrals and taking care of patients with these conditions and multiple other conditions on a daily basis from other towns, surrounding.
Right, that's really interesting. So is it a lot of pediatrics or mostly adult populations?
In dermatology, we treat from pediatric to geriatric. So it just varies, my day like today consisted of a very busy day and I saw all ages. So it's hard to pinpoint just one population. But
Right.
we see from newborn, as I said, to geriatric patients. We provide medical care for all of them.
And in picking out methods or modalities that you might use, how do you go about selecting them for the practice?
So you mean selecting the type of treatment that they will receive?
Yes.
So it depends. If we're talking about skin lesions that need to be removed, say for instance a wart. If it's a child, there's always there's always some discomfort when removing a wart when you use liquid nitrogen. So we may be less, prone to use say a liquid nitrogen gun to spray it off. We may choose to use a topical. If it's an adult, we may think differently and use liquid nitrogen on that patient to remove the warts. So different patients who present, it's a judgment call. With peds, definitely, in the past, we really avoided, treating molluscum or warts with liquid nitrogen, because, as I said, because of the discomfort involved with it. Now we're able to use a machine that's really helped us and kind of advanced, our practice for treating those conditions in this younger population.
Mm-hmm. And we're the title of this is to talk about new techniques, new methods using cryosurgery. And you mentioned that the practice has liquid nitrogen, which I think every dermatologist has been trained on and typically used. And sounds like you've had much the same experience. You're looking at new methods, which we'll talk about. But why are you willing to consider some alternatives to liquid nitrogen?
So the reason that, if something can provide the same outcome with less discomfort and also provide another means of treatment, say for our pediatric patients who we were not treating before, then why not?
Mhm.
This is
Yeah.
another tool that we can use to get rid of some of these things like warts or molluscum contagiosum. There are several different tools that we can, or methods we can use to treat these conditions, but the more you have, I mean, that just will provide, a higher chance of a faster outcome and a better outcome for the patient.
Yeah, yeah. No, that makes sense. And so it sounds like standard of care, the workflow, the practice, and its consideration for the patients all come into play as you had mentioned. And so let's talk about some new things then with cryo. We understand and as part of this webinar that there's a new piece of equipment that you're working with. If you want to describe that for everyone.
Sure. In our office, we practice evidence-based medicine. And, as you mentioned earlier, we're big fans of liquid nitrogen, of course. With the cryo, after it was presented to us, I took a huge interest in it, and it's really been a game changer. The CryoLab providing cryogen has been very precise and accurate and treating some of these lesions, and also the discomfort has been less. So this has been huge, as we were just talking about a few minutes ago, about for our pediatric patients.
Hmm.
Instead of going with one or two treatments that we would usually do, we have another option now, and it seems to have been working out in their benefit, which is why we're here, for the patient.
Right. So with the CryoLab, what cryogen gas are you using? It's not liquid nitrogen, correct?
That's right. So I'm currently using the cryogen that's provided, by the CryoLab company, and I use that for medical purposes. In our practice, it's used for anything that is benign, meaning seborrheic keratosis, warts, verruca vulgaris, molluscum contagiosum. We have not, even though I know the indications are there, or from what I've read and understand that, for actinic keratosis, we just have not implemented that yet. It's still new to us, but in the short time that we've had it, it's been very beneficial. So whether we do that in the future or not, we'll see.
Right. And so CryoLab primarily in your hands, from what I understand, is using nitrous oxide,
Right.
which is the coldest portable gas next to liquid nitrogen that is available. In the use of it, can you describe a little bit about how CryoLab works and how it operates for you?
Sure. So CryoLab, is used by a handheld tool. What I describe is more like a wand. And the wand is, placed over the patient's skin lesion. And the beauty of it is that you get a more accurate treatment because you can move the wand back and forth or closer or further away from the lesion. And this will give you a good freezing area, but also still providing a good freezing point.
Mhm.
This limits the area surrounding the lesion that may be affected by hypopigmentation or other effects from freezing. Now with the wand, you're still able to go in far enough or come back further enough where you want to surround a very minimal area around the lesion because you want that area frozen also. And that's how it works. It destroys a tissue. It sinks heat away from the area that you're trying to treat so that you get necrosis. And we've had great results with it.
That's really good. Okay, so let's see if we could drill down one more level, just because the people on the other side watching may actually be saying, okay, how does it actually work? What are the steps you go through? Maybe if we pick someone or an indication someone presents with an SK, how might you use CryoLab in treating it?
So if somebody presents with say for instance, a seborrheic keratosis, some indications for removal may be that it's irritated or itchy or bothersome. And we call those irritated seborrheic keratosis. Other indications may be that someone just wants it cosmetically removed. So what I would do is explain to the patient that there are different procedures for removing this lesion, and also talk to every patient about adverse effects such as hypopigmentation or blistering, things of that sort. We would clean the area, and then I would use the CryoLab on that area by gently spraying, depending on the size of the lesion, either a 5 or 10-second spray. It may need multiple sprays depending on the size and thickness. Then the lesion, we give them a handout on how to care for the lesion afterwards. Usually we ask people to leave it alone. They can clean with gentle soap and water if they'd like, and if they get irritation, they can use Vaseline or Aquaphor. Usually in 2 to 3 weeks, they're doing better. They see sloughing off, and if they need repeat treatment, we ask them to come back. I haven't had that happen though. Most of the time, these seborrheic keratoses do very well with the CryoLab.
So again, I'm trying to think of the questions that are going to come our way after someone watches this webinar, and so a couple of them will be generally, what's your resolution rate when treating something like SKs, AKs, warts, skin tags using the CryoLab with nitrous oxide?
Sure. So when using the CryoLab for warts, seborrheic keratosis, and skin tags, even though all those things are treated similarly, the resolution rate may be different. For warts, the current up-to-date guidelines are to treat every 3 weeks until they resolve. So depending on the area of the wart, the size of the wart, it may take several treatments. Everyone's different. Depending on the patient, they may take one treatment. Now, as we know with warts, when we treat with any type of cryogen or liquid nitrogen, the wart can spread to the surrounding area of the wart, and they may need to be treated again. That's why we bring them back, and we treat them until it resolves. With seborrheic keratosis, most of the time these patients do very well. In some instances, you'll see that patients have large seborrheic keratosis, or they have multiple, and they may need more than one treatment. Skin tags, depending on the size, just like with seborrheic keratosis. Most of the time, these patients do very well, and it's not often that they come back to have these areas sprayed again. As I said, they're just very large lesions. But when I talk to patients, I tell them the most important thing is, whether they're being medically treated or cosmetically treated, the most important thing is when removing this is the cosmetic outcome. We want a good cosmetic outcome. The last thing we want is for someone to have a lesion removed and have a worse cosmetic outcome than they did before the lesion was removed. And so far, we've had a great cosmetic outcome using CryoLab on these lesions.
That's great. So one of the other questions that often comes up is, how many lesions might you treat in a single visit with someone who, say, has multiple skin tags or multiple SKs?
So when somebody has multiple lesions, it depends on the area involved as well as their tolerance. When somebody has multiple lesions, I found that CryoLab is a good tool because the discomfort is not as much as it would be with a liquid nitrogen gun. It's individual. If somebody has multiple lesions, we discuss it with them, we talk to them, and we want to make sure they're comfortable when they leave the office. So it wouldn't be unusual to do, maybe 10 or more lesions at a time, depending on the surface area involved. Some of those patients may have to come back, a few times to have more removed. And usually this is not a problem. If somebody has multiple lesions, we want to clear an area first and then bring it, make sure that does well and bring them back and do the other area. For instance, if they had some on their face, we may treat that area first and then bring them back several weeks later and treat their back.
Mm-hmm. No, that's it's really important, because very often the question's asked what to communicate to the patient as far as expectations for resolution. And also, again, it's rare that a person has one spot only to be treated, especially as we age. There's changes that occur, and multiple spots are very common. So 10 is about your limit. And would you also treat that many with liquid nitrogen in the past, or has CryoLab changed your practice a bit?
So that's a good question. So with liquid nitrogen, we would, and everybody is different. So it just depends on the size and the area involved, So say somebody that would have this on the face for cosmetic reasons, you still want to take the same care for a medical reason as you would for a cosmetic and removing these lesions. So if you were concerned about significant, hypopigmentation or even hyperpigmentation from spraying these areas, then you may, end up doing more than one treatment. But once again, it's an individual thing. It depends, and that's usually up to the provider when they come in to see us. And some people want everything off, when they come into the office. And, we try to counsel them on that because once again, at the end of the day, we want them to have the best cosmetic outcome.
Right. So among all the possible ways to treat, and you said we evaluate, we look at the patient, what it is we're treating. Now with cryosurgery, it sounds like you've got two options. You've got the liquid nitrogen that's been there for a long time, and now you've got a newer generation CryoLab where you can use nitrous oxide or carbon dioxide. We didn't spend any time on that because it's really been nitrous oxide has been your focus. What percent now of when you think of the week and the lesions that you're going to treat cryosurgery with, what percent are you now treating with CryoLab as compared to liquid nitrogen?
So for seborrheic keratosis, probably 70% of my patients now that present with seborrheic keratosis that are irritated, itchy, and bothersome, for medical reasons, I use CryoLab.
Mm-hmm.
For cosmetic reasons, if it's on the, depending on the area, say, for instance, including the face, I've gone to about, now I do 50% probably with CryoLab. There are other tools and mechanisms we use when we remove SKs, such as, surgical blades, curettes, things of that sort. But my numbers have increased significantly because of the results that I've seen with CryoLab. And I have a feeling that they'll continue to go up.
That's great. So within the practice, are any other practitioners using cryosurgery at this point other than the dermatologists themselves?
Yes, sir. Myself and my colleagues use it. I think I use it the most because I've been educated on it the most. Meaning I've really studied it, I've tried it, and I've followed up on my results very closely, like I do with every patient. But I've really followed these to see what the outcome is. And it's not uncommon that one will call me to go help them and ask, do you think CryoLab would work for this? A lesion on the face, or if they will send one of the kids over so that I can treat, because now we're using a tool to freeze these, molluscum or these warts that in certain places may not have been frozen before on these very, very young pediatric patients.
Yeah, I mean, just speaking with you, I could tell you likely have a very calming effect on the young children. You just come across as just, patient and, do you find, especially with the younger patients, when you use CryoLab, are they interested in the way it looks and how it works? Or how do you present it to them?
So what we try to do is, the machine itself is very interesting, just looking at it. And
Mhm.
to take away any type of intimidation, we have it on a cart. And then we have stickers on the cart, that we carry around. Usually because of the wand is what I call it. I call it a wand that's connected to the machine. I'll let the patient hold it
Mhm.
and show them, that it's something that's going to help them and not harm them. And I always explain that when, they feel the spraying effect, it's going to be cold and it may sting a little bit, but it's nothing like, some of the other treatments, that we use. And they usually do fine. And not only patients, but parents, we educate them on that and they're really go with it. Most of the time when a patient comes in the office, they want to be treated and they want things to be done. So I think, by letting them know that this is a good tool to kind of help start resolving their issue, they're all for it. And even if they come back for a second treatment, they're fine, And
That's
I
great.
think the
Yeah.
results are.
Yep. No, that's great perspective. And so before we wrap up, let me ask if you have any final thoughts about your use of CryoLab. Remember, these are practitioners on the other side of the video who may be listening, and Jason, you're well respected within the community and within your profession. So I don't know if there's any message you'd want to give them about this particular approach to treating these lesions using CryoLab, but let me just give you the floor as we start to get to close here.
You bet. So, in dermatology, we're blessed because we have so many different tools we can use to help our patients. And that could be from laser, to facials, to medical surgeries. I really do believe that CryoLab has really benefited our practice. I mean, I never promote anything that I don't believe in. And after using this tool on so many patients, and even all of my pediatric patients who have responded well, I really have found it to be a huge plus for our practice in removing these benign skin lesions. And I'm hoping to use it on many more things in the future. All of my colleagues who ask me daily on how to remove things, what do you do for warts? What do you do for certain lesions? CryoLab has been one of the things I've been mentioning to them. I think it'd be a huge benefit to any dermatology practice. Liquid nitrogen is great. I still use liquid nitrogen, but once again, in those certain instances, which is a lot for our practice because we're busy, CryoLab has been so beneficial because, as I said, we can now use that on those patients who are very hesitant to receive liquid nitrogen, and also the patients who we were hesitant to spray with liquid nitrogen because of concern for adverse effects. So I think it's going to be beneficial to any dermatology practice.
Well, Jason, thanks so much for your time today. And again, for practitioners out there who may have questions, please feel free to email those in. We will get them answered for you. Again, a big thank you to Jason Dominguez, physician's assistant at Chappel Rosso Dermatology in Odessa, Texas. You guys have been really awesome, and we're very glad that CryoLab has become such a good tool for you in the practice, but especially for your patients and the outcomes that they see. So again, thank you everybody for attending, and we will see you again next time.
Thank you.